Hello students, I'm Dr. P.K. Jain, Chairman of the College of Critical Care Medicine, and I want to talk to you about a very important part of your training, which is the orientation program. The exam conducted by the College of Critical Care Medicine, the Part 1 or PCCM and the Part 2 or the FCCM exams are very different from any exam you would have faced. They're extremely in-depth and they're very practical. They prepare you not to be an inspector, but to become a commando of critical care medicine so that you can tackle any problem once you go into practice. For that, you need an in-depth knowledge and you need to know how to tackle a problem in the limited time that represents critical care. And so you've got to be fast. You've got to not make mistakes, and that only comes from training. Past 30 years experience has taught me, talking to candidates who haven't done well and those who have done well, that most candidates who have been unsuccessful in this exam were people who never attended the orientation program. They had no idea how they should approach a problem. They would look at a blood gas and just pick up metabolic acidosis and think that that is the end of blood gas interpretation. They would pick up hypokalemia and say, oh, what more is there to know? Just replace the potassium. But what you will learn here is that there is so much more. You will be surprised how these simple investigations can lead you to a very narrow differential diagnosis. On basis of hypokalemia, our students have picked up an adrenal malignancy, they've picked up coarctation of aorta, they've picked up Gitelman syndrome, they've picked up acid-base abnormalities, which most people would be surprised at. And this is the level of training that is expected. So, having not attended the orientation program, in my opinion, they waste 1 year of clinical time in which they should have been actually practicing what they've been taught, and they come for the exam totally clueless as to how to approach a problem. I don't want you to make the same mistakes that these candidates have made. During the COVID, we had no option but to hold online orientation, but they're not as effective. There is nothing as effective as physically interacting with the teacher, getting your problem solved, and literally hand holding when you are confused and not able to solve a problem. The teachers in the orientation program have many years of experience teaching, and most candidates who have attended have expressed that this is a life-changing course. What will you get to know is we cannot teach the whole critical care, but the approach to common problems like electrolyte disorders, acid-base disorders, approach to ECG's interpretation, approach to X-ray CT scan interpretation, how to read for your theory and vivas in the 1 year that's coming, how to get the maximum benefit out of it, how to read a chapter so that you can answer problems. Here, you will not get questions like what is the etiology of pancreatitis and you say, oh, gallstones and alcohol. That's a very bookish approach. But you will get problems that occur at the bedside. For example, you may be asked, when would you refer a case to the surgeon? Or when would you order a CT scan in a patient with pancreatitis? So they're practical problems, and you are taught how to extract that information from a chapter when you're reading it. You're also taught how to face a viva. You're also taught how to examine a patient in 5 to 6 minutes or 7 minutes so that you can pick up all the clinically relevant findings and be able to combine these findings into a meaningful differential diagnosis and to plan out a management strategy. You see, if you get half an hour to solve a blood gas and 1 hour to examine a patient, then most candidates would be able to pick up most of the problems. But in real life, if you're an intensivist working in the ICU, you don't have the luxury of an hour to examine a patient or half an hour to solve a blood gas. You get 2 to 3 minutes to examine a report and maybe 6 to 7 minutes to examine a case. And you have to pick up everything that's relevant. This training is not available, and if you miss it in the beginning of the year, then it becomes very difficult to catch up. There are also some candidates who have taken Part 1 exemption and directly will appear for the Part 2 or FCCM exam. They are to some extent disadvantaged because they do not have the experience of the training that they get for the PCCM exam. That is why I strongly recommend that anyone who has missed giving the Part 1 exam or the PCCM exam and is appearing directly for the FCCM exam should also make all the efforts to attend the PCCM exam orientation program that is held. That way they get the exposure that is required for the primary, and remember that's all going to come in the final exam also. So when they're giving the FCCM exam, they will be expected to know everything that the PCCM candidate knows. Plus, in addition to that, they need to know so many more things which are not there for the PCCM exam. Like they need to know echocardiography interpretation, hemodynamic interpretation, they need to know medical statistics and approach to research planning, etc. So there are many more topics. Bedside ultrasound they need to understand, and there are many topics. Antibiotics, microbiology. And there is now, from this year, there will be a separate orientation for them for these advanced topics, but they should not miss out on attending the PCCM orientation also. All said and done, don't miss this opportunity to attend the orientation program and start off in the right direction. If you're serious about making critical care your career, okay, and you want to be good in it and not just average or below average, then these 2 years are going to be extremely important for you. The PCCM exam and then the FCCM exam. Our candidates do very well compared to any candidate globally. But this comes out of a lot of hard work during these years. And the college will guide you at every step. There will be weekly teaching programs. We have an academic diary which you need to maintain, and that also how to accumulate academic credit points. You need to accumulate 150 credit points, of which just attending the orientation program gives you 30 credit points. So that gives you a big boost. And if you score less than 100 academic credit points in a year, you really are not eligible to appear for the exam. You require a minimum of 150 academic credit points. So don't miss this opportunity, and I will be frequently speaking to you. We will be frequently interacting on WhatsApp and on Zoom. So take care, plan your career properly, and I'll see you in the orientation program.